We are entering a new age for remote monitoring and telemedicine where we bring healthcare access to our patients into their very own homes. Now more than ever, digital tools and remote monitoring technologies are becoming available to almost anyone and anywhere, no matter where you live. And this paradigm shift will significantly alter the healthcare landscape for all of us going forward. Change is coming, and it's much needed. So what can healthcare executives and physicians do to ensure a smooth transition? Welcome to the Clinical Divide. I'm Dr. Kevin Campbell. I'm a Duke-trained cardiologist, and I'm the CEO of the health data startup Pacemate. Every week, this healthcare analytics news video series examines healthcare technology and medicine's top news. I try to bring the views that help physicians and healthcare executives bridge the clinical divide. Let's talk about remote monitoring. Last week, CMS, or the Centers for Medicare and Medicaid Services, made headlines. And they did so by finalizing several rules, all of which CMS says are meant to reduce administrative burdens on physicians and improve patient care and our ability to deliver care. These types of reforms have been long awaited and are much needed as burnout and job dissatisfaction among physicians are at an all-time high. There's one rule change in particular out of the many that were released that I want to focus on today for our segment. On October 31st, CMS changed Medicare's home health prospective payment in a big way. Starting in 2020, CMS will now reimburse home health providers for the costs of remote monitoring technology. Remote monitoring plays an important role in the prevention of disease and also in cost containment by allowing physicians and patients to have digital touch points in between office visits. No longer will patients go months without an intervention or office visit. Remote monitoring technologies, which have been around for a while, allow physicians to get a look at the patients and their health status in their own home environment, which is really important. In the cardiac device space, these types of non-office assessments have been shown to really make a huge difference on morbidity and mortality. In a meta-analysis, for every 1,000 patients with cardiac devices who are monitored remotely, 53 deaths and 32 strokes are prevented. Imagine the savings in lives and dollars. I applaud CMS for this rule change. Too often our government agencies ignore new technologies or make the approval process so arduous and difficult and expensive that we can't get anything through. This is forward thinking, a high-tech move that could result in several positives for healthcare. CMS says it will encourage healthcare's adoption of these new technologies and encourage better data sharing for both acute and chronic care planning. This rule change addresses some of the most important issues in healthcare today. We've said it before: patient empowerment, patient engagement, and improve patient experiences. Now here's my take. I think this is a major win for telemedicine and remote monitoring. But more importantly, this is a transformational step for healthcare. By greenlighting Medicare reimbursements for remote technology, healthcare delivery is destined to change. Private insurers are bound to follow. After years of struggle, telemedicine could become mainstream. Regulations could be formulated that are more helpful to doctors doing telemedicine. And this is a critical step towards improving patient care. In the U.S. today, we spend far too much money for the treatment of preventable illnesses, as we know. Moreover, not all Americans have access to quality, affordable health care. This decision by CMS is very likely to improve access to care by helping patients receive care more often and in new, innovative, and different ways, combining the classic office evaluation with remote and digital visits via the use of digital tools and telemedicine. That's especially important for people in rural areas, folks who don't have regular transportation, and for those who really have a difficult time getting to the doctor's office for acute care. This can really change everything for us. But here's the thing. Healthcare executives and doctors need to work together and go a step further by continuing to advocate for remote care reimbursement for everyone. Whether it's in the home health setting or another setting, collectively, we need to push for reimbursements when it comes to remote monitoring of devices, such as pacemakers and ICDs. My startup company, Pacemake, has really capitalized on this. We've automated and digitized the remote monitoring of ICDs and pacemakers and loop recorders. We find that our patients, as an example, have become much more engaged, and that our physician customers and hospital customers feel as though they are really more in tune with their patient's health status and can provide better care. At Pacemate, we clearly see the benefits of remote technologies every single day in the form of our improved patient outcomes and more efficient clinical workflows. But this can be applied everywhere outside of the device industry. In order to make this healthcare transformation a reality, a team effort is required. Administrators must support the effort to acquire these new technologies and must work together with physicians to evaluate and implement remote monitoring and telemedicine practices. We need to double down on these technologies and care delivery systems that will ultimately hold costs down and improve patient outcomes, which is what we're all about. Remember, remote technologies in medicine are coming. A lot of them are already here, and it's incumbent upon each and every one of us to make sure that these technologies are utilized for what matters most: improving access to high-quality care for all patients, regardless of where they live and what their socioeconomic status may be. Remote monitoring, telemedicine does that. Thank you again for joining me for this episode of The Clinical Divide. I look forward to seeing you next week. Until next time, I'm Dr. Kevin Campbell for Healthcare Analytics News.